Welcome to all of you, some piping in from close by, some further afield, so good morning and good afternoon. And welcome to our first inaugural symposium on science, diplomacy, and partnership in Africa. My name is Jennifer Cook. I'm director of the Institute for African Studies, which is housed in the Elliott School for International Affairs at the George Washington University here in Washington, D.C. I want to welcome our audience members from across the world, our partners, and Dr. Eric Villain will go more depth in thanking our partners on this. And I want to thank our participants and our speakers today. At an extraordinary moment that is extraordinarily busy and fraught, we are really grateful to you for taking the time to share your insights and expertise and perspectives with us. Our topic today, strengthening science diplomacy in Africa, is an extraordinarily important and timely one. Just a little bit of an anecdote of how this started. About a year and a half ago in my US Africa policy class for graduate students, as students were introducing themselves, one student, and you'll hear from him later, said, "I'm a PhD candidate in studying genomics and precision medicine, and I'm not really sure if I should be in this class." And I said, yes, of course you should be in this class. First, please explain to all of us foreign policy wonks what genomics and precision medicine is. It turned out to be a very lively class. The interactions and the different perspectives that came together in that class enriched our foreign policy class. And it was out of that the idea for how do we better integrate the science side of the university with the foreign policy and international relations side that this series and this seminar grew up out of. Now that was all well before COVID crisis was even on the horizon. And I think at this moment with the global pandemic, with a new US administration coming into office, there is a huge opportunity to kind of try to elevate and promote the need for deeper, better, and expanded science cooperation that is more transparent, communicative, and collaborative across the world. So we're really glad that we're moving today's event forward. So our aims today are threefold. First is to galvanize our university and the academic community more broadly to better connect the science and foreign policy communities, health, kind of bridge that health, science, international policy divide. The second, as I said, in this moment of global crisis with a new US administration about to accede to office, we want to highlight the opportunities to renew and reinvigorate US science diplomacy and engagement and build on some of the very effective programs that the US has had in place. And we'll hear about some of those today in the panels. And then finally, to hear from some of Africa's most eminent, prominent thought leaders and scientists in public health and infectious disease in research, to learn about their priorities, perspectives, and their thoughts on what kinds of expansions and collaborations going forward are going to be of most mutual benefit. I'm going to turn quickly over to Dr. Eric Villain to say a few words. Dr. Villain has been our partner in this, and then I will turn to introduce our guest of honor today. So Dr. Villain, the floor is yours.
Thank you, Jennifer. I'm Eric Villain. I'm the director of the Center for Genetic Medicine Research at Children's National Hospital in Washington, D.C., and the chair of the Department of Genomics and Precision Medicine at George Washington University. I really think that we're very fortunate to work on science diplomacy in a multidisciplinary fashion at this very particular moment in history. All global politics aside, this pandemic, in terms of the scale of the crisis and the nature of the virus, is something that our generation has not faced before. The solution is going to require people in all disciplines to have an understanding of each other and an awareness of their interrelatedness. Rebuilding after the coronavirus crisis also presents a unique opportunity to learn from those who handled the crisis better than those who, let's just say, missed the mark. From an academic standpoint, our team is uniquely positioned to leverage the unique resources and backgrounds and the faculty and staff at George Washington University and Children's National to move the state of the field forward. We're terribly lucky to have such a strong lineup today. This should result in some actionable items and perhaps even a meeting report. But none of this would be possible without George Washington University Provost's Office, who funded us as a university seminar, as well as the French CNRS Laboratory on Epigenetics, Data and Politics that I've led since 2014. The Children's National Hospital Center for Genetic Medicine Research employs me, my graduate student, John Lotempio, and my two staff scientists, DeAndre Spencer and Matt Bramble. We're all passionate about this project and our vision of global precision medicine, and it could not happen without institutional support. So I'd like to thank our Chief Academic Officer, Dr. Mark Bacho, and Chief Research Officer, Dr. Vittorio Gallo, for their constant encouragement. Now for some housekeeping. As you have noticed, this event is being recorded. We will try to make recordings available at a later date. All questions should be posed in chat, where John and DeAndre will work to collate them and get them to the moderators. Since all our panelists are so accomplished, we won't read their whole CV. We'd be here all day. Instead, we have a landing page where you can find their biographies. We sent this to you last night if you pre-registered, but since we have some new attendees, John has placed it in the chat. Thank you again all for being here. It's very exciting. And now back to Jennifer and our keynote speaker.
Thank you, Eric. And again, thanks to all of our partners that have supported us this. I should mention Miriam Deloff of the Humanitarian Action Initiative at GW has also joined in this effort. To our keynote speaker today, Dr. Nkengasong, they say that cometh the hour, cometh the man. And I think really in this particular crisis on the African continent and globally, there is no one who I think who could have brought the kind of same steady hand, leadership, transparent communication, patience to this endeavor as our keynote speaker today, Dr. Nkengasong. Throughout, this is at times been a politically and diplomatically fraught pandemic with recriminations and some controversies in the diplomatic field. Dr. Nkengasong has navigated those and brought Africa together, I would say, in a particularly kind of positive, collaborative manner. And the kind of leader I think that is very much needed in this kind of global crisis. As Eric said, I don't want to go deeply into the bio because it is a very long one and a very eminent one, but to introduce him as the director of the Africa Center for Disease Control and Prevention, and the creation of that is a story in itself. Until recently, he had served as the acting director of the Center for Global Health with the US Centers for Disease Control and Prevention. He's also a special envoy for the WHO on COVID response and preparedness. Long expertise and experience in public health and research going back some time. Dr. Nkengasong, we're so delighted to have you here. We thought we would give you the floor for as long as you'd like, frankly, but then open to questions and answers, perhaps get a sense of what you're seeing in terms of the COVID trajectory right now, but then moving to the theme of what we're talking about today, what are the kinds of collaborations and partnerships that are going to make most sense for this crisis, but then for future crises and pandemics and challenges that we're likely to meet. So again, thank you so much for taking the time to join us. We're delighted to have you with us here at GW at the Children's Hospital.
Greetings from Addis Ababa, Jennifer, colleagues and friends on this very important webinar. I see Peter Kimax. Hello, Peter. And I'd also like to, Jennifer, thank you specifically for extending the invitation to me. And of course, the Children's National Hospital, the French National Center for Science Research for hosting this very important dialogue. First of all, I would like to just, in one line, bring you up to speed with what the situation is on the continent as we speak. Today, the continent has reported close to 2 million cases of COVID-19, specifically amongst the 55 member states. And of that number, about 46,000 people have unfortunately died. And when the pandemic just started about 10, 11 months ago, one death was a lot of death. My fear is that as the pandemic gathers speed across the world, we begin to throw this number out there as statistics, and that will begin to hurt our cause. I think we really have to be mindful that these are loved ones, these are lives that are lost unnecessarily, and continue to find ways that science, technology, and diplomacy can help to alleviate this. This pandemic has taught us three major things. First of all, it's told us that we are more connected than we thought we were. It has told us that we are more vulnerable than we thought we were, regardless of whether you are in the global north or the global south. And it has also exposed the inequities that exist in our various communities in a manner that we knew that there were inequities, but were not the depth and breadth of that. Those inequities were never fully recognized. So my first takeaway, I have 4 takeaway messages there. The first is that the public health enabled the continent of Africa, or public health measures, allowed the continent to bend the curve nicely from July, August, and September. We are beginning to see a slow creeping back up in several countries, and we have to continue to intensify those measures. And in addition to that, we know that in phase 2 of this battle, science, the power of science, technology, and diplomacy will be critical in enabling us to win this fight. I think absolutely. There was no way science and technology could help us in the first phase, but there's plenty to be celebrated now because of the advancements that are happening almost every day in the field of science, technology, and the promising news we just heard this week about the Pfizer vaccine. Imagine that just 10 months ago, we knew the sequences of this virus, and today we are talking about a potential breakthrough for that. That is remarkable by itself. I think that is number one message there. Number two message is that what I allude to as the 4 Ps of a pandemic. That is the population, the pathogen, the politics, and the policy. All 4 Ps must come together if we ever have a chance to win this pandemic. And the science technology is very critical for us to understand the pathogen, which is still new compared to other pandemics like HIV. This is a baby pandemic. And we've lived with HIV for 40 years. It's infected over 80 million people. And this pandemic, just within 10 months, has affected almost more than 50 million people. So I think this is telling us that the threat is severe. And it requires that we deploy the power of science to understand the virus more. It implies that we use science to find the solutions for vaccines, for diagnostics, and for therapy. The population is also very important. How we approach the population and use technology and science to enable the population to own the pandemic, to lead the pandemic, and also to be participatory in the response is very important. What we normally would call community engagement. And it would not naturally appeal to us that community engagement requires technology and science, but it does a lot in this day and age with the technologies the gadgets that we have in our hands. I think those are very powerful tools that we have to bring to the population and the community. On this, I would like to just imagine and paint a picture where imagine that there are 3 vaccines that are in trial now show up in the next 2 weeks and to be very effective. And if the population is not prepared and ready to use those vaccines, then the upfront investments and the technology and science that we invested in it are not going to help us win this battle there. So we have to deploy the power of technology to continue to engage the community and be ahead of the information sharing. The currency for active community engagement and building trust, what I call the trust capital, is good information. And good information comes from good technologies. I think that is very, very important. With respect to policies, I think a bad policy equals to bad response. I mean, absolutely no doubt about that. And of course, it's linked to politics. We have seen how across the board, how bad politics is a threat to the pandemic response, how good politics is a good tool that is an enabler for us to respond. At the Africa CDC and the African Union Commission, we have been able to earn the trust of the highest leadership of the continent by Chairperson Moussa Faki and the leadership of the African Union, headed by President Cyril Ramaphosa, where he has actually believed in science, believed in the ability of the Africa CDC to lead this response and convene us at least 8 times as a disease control agency to brief a Bureau of Head of State, and usually about 12 to 15 of them, where they put you in the middle and the center. They say, tell us what is going on, what is the strategy, and where should we go from here. I think that is where the politics and science all come together, where they believe in this. But there's an element of trust. I mean, the glue that holds the 4 P's together is trust. I mean, they're trusting what I call the trust capital, which I alluded to earlier, is that glue that will bring the politics, the policy, the population, and the pathogen. In this pandemic, we were able, in the last 3 weeks or so, to launch the Pathogen Genomic Initiative, which is part of a Pathogen Genomic Institute. I mean, and this is, again, it speaks to the power of cooperation and the power of partnership, which it was supported by the Gates Foundation, Illumina, and many other partners, including the NIH, the US CDC. And I think that is a very good initiative that will allow us to apply science to understand both the population and also the pathogen. My third point is that none of this will matter if we do not also focus on 4 C's. That is the ability to cooperate, the ability to collaborate, the ability to coordinate, and to communicate. It's so powerful because we know that there's nothing of significance in this day and age in the 21st century that will be done in silos, that will be done in inward looking. It has to be that ability to share, the ability to express solidarity, and the ability to understand that no one will be protected from COVID if anyone is a threat by COVID there. So COVID infection anywhere in the world is COVID infection everywhere in the world. And you require the 4 C's, the power of the 4 C's to unlock that ability there. So I think we, at the African Union, and we have been applying these 4 C's very effectively. And there are products out there to be shown. We launched the partnership to accelerate COVID testing in June, where we realized that the continent was in acute shortage of diagnostics. And that initiative really allowed us to set ambitious targets and strive to reach the targets through a very coordinated approach. We had to train people in Senegal, countries in Senegal, brought them to South Africa, trained them, worked with different partners to really push out diagnostics so that they could be applied appropriately. That was the power of cooperation, the power of collaboration and coordination. We have also launched a platform called the African Medical Supply Platform, which is the equivalent of Amazon.com, where we realized that it was challenging for each country to go out there and source for protective material and diagnostics. So today, if you all Google that, you'll see it, and each member state in Africa can go through that platform and find and procure whatever commodities they need. I think with standard prices and access to delivery. I think that is based on the power of partnership with the private sector, partnership with the public sector, and partnership with the business and individuals there. We have now launched what we call Africa Against COVID-19, which we recognize that as the pandemic shift and we are easing the lockdown on the economies, we will continue to see hotspots and increases in number of cases. So this initiative strives to protect our borders, protect travel, protect economies, protect schools. So that, we can increase testing, increase surveillance across the board, identify hotspots and bring them under control. As we speak, we have special envoys that were named by the chair of the African Union, President Ramaphosa. They're out there working with the World Bank, the African Development Bank, the IMF, to look for additional resources to support and boost the economy so that the continent as a whole can reset its economic and which is very critical for us to continue to fight the virus, because we have to look at that as an economic threat, and it's a national security threat. And I use the word national security very deliberately, and of course a health threat. And lastly, let me just end with the Pathogen Genomic Institute, which is really one of the very exciting things that we've done during this pandemic. And it speaks to the power of partnership, the power of cooperation, where with the Gates Foundation and other partners, we launched a 100 million pathogen genomic initiative that will allow us to continue to understand this virus well, but also other infections, use case scenarios like TB, malaria, and HIV, and use this as a platform in the spirit of what we call the rising tides raise all the boats in the sea, and make sure that we apply this pathogen genomics and the standard molecular standard epidemiology, I beg your pardon, to continue to fight COVID-19 and other emerging infections on the continent. So I think I would just conclude by saying that I look forward to an interactive discussion. The continent is watching with anxiety what is going on in Europe, what is going on in the United States. We continue to learn from our own lessons and know that the only way that we will win this battle is through science, innovation, and diplomacy. Thank you for your attention.
Thank you, and Dr. Nkengasong. A really fantastic brief, but a lot of great information packed into that. We have a number of questions from the audience, and I'll go to that, and maybe we can do a couple at a time. My first question, and I don't want to put you on the spot politically, but as we are looking to transfer to a new U.S. administration, or certainly a new dispensation, I wonder if you could say just briefly, what would be your priority message to an incoming U.S. administration? The key priority that they need to keep in mind, the key recommendation, the key priority that would help you and the many initiatives that you've laid out here succeed.
Thank you, Jennifer. It is obvious for anyone who has been in the field of public health as long as some of us on this panel have been, that when the U.S. leadership in the world is strong to fight infectious diseases or diseases for that matter, the world has always been in a better place, for sure, absolutely. There are many examples to cite. Especially from the perspective where I sit. There's a saying that your stand in any issue is where you sit. I think I sit in Africa, and we still have a pandemic of HIV going on. When the United States exercised leadership by launching the PEPFAR, the President's Emergency Plan for AIDS Relief, in 2002, 2003 timeframe, it became a game changer on the continent, and it actually changed completely the manner in which the world responded to HIV. I think that is the kind of strong leadership that is required from the United States, the new administration, to make the world a better place in terms of health security of the world. I think that is one. Second thing is really that in the area of a threat, the nature of COVID-19, there is no way you can win this by looking inward. You have to look inward, but also look outward. I mean, that is clear, because there's absolutely no way that any country in the world will declare itself free from COVID if there's COVID still circulating out there. And especially for a continent of Africa, which is 1.2 billion people, 55 member states, there's absolutely no way that this war will be declared over in other parts of the world, but continue to be sustained in Africa. So I think in sum, as I said earlier, COVID infection anywhere in the world will be COVID infection everywhere in the world. Absolutely no. It takes just a handful of people to start a new infection across the board. So my message to the incoming administration will be that consider strengthening healthcare systems in Africa as an investment in the US.
Great, thank you. So we have a number of great questions from our audience, and other panelists are welcome to join in as well. First comes from Claire Chen, which asks about kind of research capacities generally. How are African universities dealing with research capacity issue while at the same time trying to rapidly adapt and respond to COVID research? I think it's a question of kind of the bandwidth and the capacity to push forward on COVID while there are many other issues at play as well.
Absolutely. I think that I just want to be very clear that there's tremendous capacity across many universities in Africa that is, I believe, not well utilized. I think not fully utilized. I mean, if you look at South Africa, a lot of our sequences that are being generated are coming out from university academic centers, like from South Africa, from Nigeria, from DR Congo, and others there. So there are a lot of very fine, capable institutions in Africa. So the role and the key question that we have to address is how can we harness that and apply that to addressing public health challenges like the COVID-19, HIV across the continent. And that has been the limiting step where we tend to work in silos, but we believe that the creation of the Africa CDC and the existence of Africa CDC will offer that unique opportunity to create networks around the continent that will empower universities and bring them together. We have already formed an association of schools of public health across the continent, and this is we are in a third year running, and we hope that with time we continue to strengthen that network and empower them to be able to play an active part in the kind of response that we're dealing with today.
Great, thank you. We've lost your video, but we can hear you loud and clear, so we'll keep going on that. A big question to answer for all of us is from Amit Mitri, is how can we ensure fair and equitable access to a COVID vaccine and treatments in low and middle income countries in Africa and elsewhere?
That is a great question, a very topical question. I think there's, first of all, we have to agree with the definitions of what we really mean by fair and equitable access to COVID-19 vaccines. And when I have interacted with the COVAX facility or CEPI, the Coalition for Epidemic Preparedness and Innovation, I've said there are three things that we should be looking at to meet the definition of equitable access to COVID-19. One is the timeliness of that, okay, which is not just a matter of when you receive it and then we tick the box that the vaccines reach Africa, but it has to also be very, very timely. We are dealing with an unusual situation that we have to. The second is that to achieve that timeliness, we should be having a broader discussion with respect to local manufacturing of vaccines on the continent of Africa, period. There is absolutely no way that the continent will continue to ensure its health security without having the capacity and capability to manufacture those vaccines locally in Africa and distribute them. I mean, and that is where science and technology also plays a role. And thirdly is the distribution, the mechanisms of distribution. So I'll use the recent announcement of the Pfizer vaccine as an example. So the first thing to do with that announcement is to celebrate the prospects of having an effective vaccine. But then we also looked at the challenges and say if The vaccine has to be distributed, stored at minus 70, distributed at minus 70, then we're out of it. Okay, as a continent, there's absolutely no way that our continent will be able to put minus 70 deep freezers across the continent to distribute that. I think that falls into that whole category of you may have a vaccine, but the distribution is challenging, so you don't have the timely and fair access to vaccination. It would be very painful if we in Africa sat here and we see on CNN or ABC News people being vaccinated in the United States and Europe, and we cannot be vaccinated because we don't have deep freezers, minus 70 all over the continent there. Then we find ourselves in what we call the valley of death, where you have the product, but you can't get it to the people. So I think that is my reflection to that question.
And is the African CDC playing a role? I mean, where will the impetus and energy and strategy for that emanate from? Individual
so the Africa CDC has developed, of course, in partnership with member states and partners, developed a strategy for the continent, for vaccine, the continent, and it's called the Africa Development and Access Strategy. And it has 3 pillars. The first pillar is to say that we have to participate actively in clinical trials. The way that you make people own that product, the way that you make the communities believe in that product and build your trust capital is to make sure that you do the vaccine trial locally as well, so that they see their own people participating in it. They have the opportunity to ask questions and also have the opportunity to contribute. Pillar number 2 is procurement and financing of that. And through the initiative that the head of states have put in place, they're saying, look, we are ready to raise up to $5 billion from the Afri-Exim Bank to support additional doses there. If you recall, the COVAX facility says we'll get up to 20%, we can immunize up to 20% of our population. But we are saying that, no, that is not our target as a continent. Our target is, and we are not apologetic with this target, we are saying we have to immunize up to 60% of our population to have herd immunity. That is what is going to stop the virus circulating on the continent. But we're also very appreciative of what the COVAX is promising to provide, but we're saying we are ready to look for continental financing to take it to that 60%. Then the third pillar is the distribution and preparedness. We say this is a vaccine that is unlike others. We have to build the right partnerships with the private sector. We have to build the right distribution networks across and develop plans that will guide countries to be able to access these vaccines in a timely fashion. Remember, we will be striving to vaccinate about 500 million people in less than 1 year or 2 years, which is something that has never been done on the continent or elsewhere in the history of vaccination. So that is going to be learning as we go.
Yeah, great. Thank you. Now we have a few questions. Let me see. From Carrie Golitko, who will pay for the vaccine in various countries already strained by paying for their health systems?
So there are 3 streams of funding that we are looking at. One is, of course, you recall the COVAX facility, where countries will go in there and, as I said, sign off and get X amount of vaccines. There's also the World Bank has made an announcement that there's 12 billion on the table to support low and medium income countries to access vaccines. We still are in discussions with the World Bank to see what exactly of the 12 billion will go to vaccine procurement and distribution. And then there's what I just described earlier, the African vaccine acquisition and financing team that the President Ramaphosa has put together for the African Union to take leadership to access additional doses of vaccine, including manufacturing. I think that is very important. Again, it ties into the spirit of this conversation about science and technology. You can't manufacture if you don't have good science and good technology to do that. So I think those are different streams of funding that we are exploring currently.
Great. We have questions from a little bit all over the place, but one from my colleague Liberata Mulamula, Ambassador Mulamula, who's an associate director of the Institute here, is what do you see as the role of traditional medicine, also called ethnomedicine, in fighting the pandemic?
I think we have we are strongly encouraging our traditional medicine researchers to come out with their products, but do that in a manner that is also scientific, which is three things: that is standardized. Second, that you showed evidence for safety. You also show evidence for efficacy, so that we hold ourselves accountable to the same standard that we're holding the other side of medicine accountable. I think with WHO Afro, we set up a task force that is already inaugurated and has several subgroups that are working together just to offer a platform that will enable anyone who has a remedy to go through that process and in a facilitated and an enabled manner to be able to prove that that remedy is doing what they claim is doing. I think we are extremely positive. We want and believe that with that kind of coordination, encouragement, and enabling, that traditional medicine in Africa should also gain momentum to the level that you see traditional medicine in China and in Southeast Asia.
Mm-hmm. And now we have a couple of questions on kind of, one is, with the second wave and spikes happening in the United States and happening in Europe, how do you envision kind of protecting Africa in a way from those spikes from spreading into Africa, where in fact cases have been kept relatively low?
So I think, as I said earlier, there's absolutely no doubt in my mind, looking at the epidemiology of what we are seeing now, that we will see spikes, and we are seeing a lot of spikes in individual countries. I think if you break away for 1 second and look at Africa now as individual countries, you see very different patterns. There are actually three trends. One trend number one is countries that have never actually bent the curve, okay, and really the numbers continue to go up in Morocco, Tunisia. And where very early on, they seem to have controlled the virus very well until late August and September. Then it all went up. Then second set of countries are those that bend the curve nicely, and now we begin to see the tail creep up a little bit, and we're raising all kinds of alarm and warnings and making sure that they do not relent. Then the third category of countries are those that continue to see a downward trend in their numbers. I think that is so. If you unpack the continent, those are three trends that you see. Now, what do we do to ensure that we did not have a rapid rebound? Is political leadership. We have to have strong political leadership that will make sure that you have the mass, and that you have the mass and subsidize it. You cannot assume that because mass, you can some people can afford a mass, a simple mass, that everybody can afford a mass. So I'm calling on governments to subsidize that for the common person to have it, and they can use it appropriately, because it's also the appropriate use of mass, not just having the mass. That is our vaccine for now. Our most effective vaccine for now is the masking. I think Dr. Tedros used to say, test, test, test. I would say test, 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 but mask, mask, mask. I think that is what helped us to bend the curve from July and August to now are the same tools that we have now that can enable us to maintain that for a long time until we have the vaccine. That will definitely bring that to a closure. Second is we have to, as we ease the lockdown on the economy, which we should do, we should intensify our surveillance and so that we can survey and pick those hotspots that will emerge from this the pandemic and do something with it as quickly as possible. The third thing is that what I call prevention fatigue, and this is the community engagement and community response. We cannot, as a continent, exercise prevention fatigue, which is a way you relax, and we say we are not seeing so many deaths in our community, and we will now stop using applying the prevention. It will be devastating for the continent if we do that. So I've started a tour of the continent. I just came back from Cameroon on Monday. We'll be going to DRC and Kenya and we are splitting ourselves into small groups to just continue to really hammer home that message as strong as possible to the political leadership, and to say, you've done well, you sacrificed a lot by shutting down your borders and your economies early on in March, aggressively. It paid. But if we relax and we show complacency, then those gains will be completely eroded. I think that is the purpose of our road tour that we are conducting across the continent.
Any chance you would like to make a U.S. stop? Those are not problems unique to Africa. And it goes to a question, how do you get people on the preventive side? And then, as is happening here in the United States, a lot of deep distrust about an eventual vaccine. There was already kind of an undercurrent of anti-vaccine fear. The issues got politicized here. So a question from Charles King, is on how do you convince people to take it? How do you encourage people in densely populated areas with high immune compromised populations to take the vaccine as mistrust is growing? There've been bad examples from the past, even from the 80s and 70s I think in northern Nigeria, where people still remember some of the bad experiences with vaccines and with tests and trials. And so, what's happening here is also happening to some extent in Africa. I wonder how do you get at that fundamentally? I mean, you're the right messages and doing the tours, but it's going to be a hard nut to crack, I think.
Yeah, it is. The short answer to that is clearly that I don't know. I mean, the answer, but this is what I think that we have to do. Again, is that trust capital in the community. We cannot. The most potent tool that we have in our toolkit, or that we will have in our toolkit will be a vaccine. I mean, major pandemics have never been won without a vaccine central to it. The reason that we have not conquered HIV is because we don't have a vaccine. We have one of the wonderful treatments. We have wonderful diagnostics, but no vaccine. Malaria, I hope that with the introduction of this new malaria vaccines, things can change. Now, the US is the megaphone of the world. And what happens in the United States matter across the world. So if that movement is not stopped in the US or corrected, let me say, then it becomes, it spread to the world. It will be devastating, to say the least, in not just for COVID-19, but for other vaccine preventable diseases that we all fight day and night to bring under control. So my hope and wish is that we engage the communities, effectively, and in smaller groups, like in communities, like the nurses. There's, I think, in a conversation the other day with someone, they said they did a survey and about 40% of the nurses in the US said they would not be open to taking the vaccine. That is terrible if we have that. So that means we have to do an adaptive approach where we target those communities and develop a peer strategy where nursing to nursing talk to each other and encourage them, rather than someone saying it from outside of those communities. And that will be true for other the doctors and people who are not in the medical community. But we cannot leave that up to chance. It has to be a targeted program that is designed for that. Unfortunately, technology is also on the other side, and it plays at times in the hands of those who are advocating against vaccines, and they put out misinformation. And what amazes me is the power of people to gravitate towards wrong information and consume that wrong information than consume the right information. So I think it's a work that we cannot ignore. We cannot wish it away, but we just have to be very deliberate in thinking and finding all kinds of solutions to bring back the vaccine confidence.
Thank you. We'll just have a couple more questions from Elwemuno Blyden. Does the Africa CDC have guidelines or develop pathways for licensing of countermeasures. So vaccines, therapeutics, diagnostics made locally. Is that part of the effort that you were talking about earlier?
Absolutely. I mean, it's amazing that we, just before this webinar, we were discussing with a working group that has been put aside to work on regulatory issues and then bring the whole of continent expertise together. That is WHO, AVRF, and AU, NEPA to come together and begin to lay out a framework that will guide how uptake of vaccines will be conducted in African countries, so that we don't go from one country to another to license vaccines, but that you can use a centralized approach and use the power of the African Union and Africa CDC to facilitate that. So that is, there's a lot of work going on in that area as well. And that is true for diagnostics. Before COVID hit the continent, on September 24th last year, 2019, we actually set up a program called AFCAD, African Collaborative to Advance Diagnostics, where we knew that if and when we would be hit with a pandemic, it would take a process to approve diagnostics there. So I think hardly did we know that we would not even have the time to implement that before COVID challenged us. I think we are now scrambling. We have a network of labs that are evaluating technology, and that we will be happy to put our stamp of approval to it so as to fast track that way the technology is used adequately.
Great. Then let's say a final question, kind of having to do with, this pandemic and the global geopolitical climate that we're in. This comes from Dalil Najib. What are you going to ensure to ensure equal partnership following the disruption and collaboration between global powers? It's played out in the WHO, it's played out elsewhere. Maybe you can talk about kind of the global geopolitics of this and how we get over the disruptions that's caused.
So I think that speaks to our the third piece of this conversation, which is the diplomacy in this. And I think permit me speak as a technical person and not a diplomat, but I'm sure some of those elements will be important. First of all, let me start at home. We believe strongly as Africa CDC and the African Union that we need a new public health order for Africa. A new public health order for Africa that addresses 4 areas. One is that it strengthens our national public health institutions across the continent, such that, in other words, call it the mini CDCs. And all of this forms a network around the Africa CDC. That is important, so that we can be able to, Africa CDC in future, develop your own diagnostics in-house and then serve member states in a timely fashion, these mini CDCs in a timely fashion, so that they can respond to the next pandemic. I think it's so important. Why is this so? When we knew COVID was coming. We actually wrote a paper in Nature Medicine in January 27, where there were only 200 cases in the world. And I said, Africa, we have to be very careful. This is going to hit us. And here we are. I mean, 200 cases in the world. We knew that what we could do, but we just didn't have the capacity and capability to prepare the continent enough. I think in terms of even diagnostics, we had to send somebody to go to Berlin, carry one of the 10,000 tests in a suitcase, bring it to Addis Ababa, and we started distributing it across the continent. That has to stop. I think that in the spirit of new public health order, we have to be able to produce those diagnostics locally there. So strengthen our national public health institutes, produce diagnostics and therapy locally. And then fourthly is really focus on our workforce development, a competency workforce development in 3 areas: community healthcare workers, the frontline epidemiology, and the long-term, what you call the field epidemiology training programs. Technology will not deliver these things. The technology will only enable this, the 3 categories that are indicated, to be able to be more responsive to the next pandemic. And the last thing is what I call trusted partnership. And the trusted partnership is what I call the balancing of power. And that brings me to the last point, which is we have to envisage a new health security architecture of the world. That will start from an empowered WHO, but don't throw everything on WHO. It has to empower WHO to do the things that we have to do. But you also look regionally and say that WHO cannot, from Geneva, be the Ministry of Health of everybody. You have to now look regionally, and you work more and strengthen organizations like the Africa CDC and others like PAHO and others to take a lead in doing and in protecting the region. And lastly, the national institutions. That should be the three pillars that will ensure the health security of the world going forward. Global health security is meaningless if national and regional health security is weak. I think that we have to admit that we have seen it in this crisis, that some of the over-centralization of our thoughts, it doesn't really help in the response. I think that that would be my response to that question.
Dr. Nkengasong, I just want, on behalf of the audience and all our fellow panelists, I want to thank you just for a brilliant exposition of kind of the problems, the challenges, and everything that Africa CDC is doing. I think that final thought gives us a lot of fodder for kind of further explanation and discussion in our conversations today and going forward. We are all rooting for your success and the success of Africa in the pandemic. As I said at the start, you know, it's very energizing and confidence building to have kind of you at the helm, leading these discussions across the African continent. As I say, you would be welcome to come to the United States to bring that message here as well. Thank you for your global leadership on this, and thank you for joining us today. We very much hope we can stay in touch going forward.
No, absolutely, and thank you for the very good work you're doing out there at the George Washington. I think your work will continue to be very critical as we advocate for the after COVID-19. I think we have to come out of COVID-19 looking better than we went in as a continent. Thank you all.
Fantastic.